I can still remember walking into my 2-year-old son's room and finding him turning blue because he was struggling to breathe. After an emergency trip to the hospital and many specialist appointments later, Jaden was diagnosed with asthma. Now, fortunately for Jaden, his chronic childhood asthma has resolved with age and he no longer struggles with the shortness of breath that the condition causes. Of course, unlike Jaden, many people continue to live with the disease into adulthood. So what happens if that adult wants to sing? As you might expect, asthma can have a significant impact on the voice. So today, we're going to unpack the condition, its effect on singing, and how best to manage the symptoms.
Sound check. Check 1, check 2.
Hello everyone, welcome to Voice Essentials. My name is Dr. Dan and I'm a contemporary singing voice specialist, and it's my job to help you realise the full potential of your singing voice. And it's pretty difficult to get the most out of your singing voice when your starting point is simply struggling to get enough air to live. Fortunately for many sufferers of asthma, our understanding of the two main components of asthma, inflammation of the airway as well as airway constriction, have led to the development of excellent medicinal treatments. As is often the case with many prescribed medicines, when taken long term, there can be side effects. The severity of the side effects caused by asthma medication have also improved significantly over the past 50 years. But if you're currently taking inhaler medications for your asthma, you should be aware of the potential side effects on your voice. For example, if you regularly use Ventolin, you may experience a dry mouth as well as an irritated throat. A dry, irritated vocal tract may be more susceptible to the development of vocal pathologies like nodules, for example. Furthermore, long-term use of asthma inhalers in their various forms can lead to a fungal infection, also known as oral thrush. Oral thrush can leave the singer with a severely impaired vocal function, including reduction of range and painful phonation. But not all voice problems resulting from asthma are a side effect of medication. The other major cause of voice complaint with asthma sufferers finds its roots in the lack of well-managed breath flow we typically associate with healthy singing.
Sound check.
Now, you might be forgiven for thinking that the best way to resolve this issue of consistent breath flow, or the lack thereof, would just require a dedicated implementation of breath management exercises. Well, yes and no. Yes, because learning to manage one's breath is an important process to undergo for every singer. But no, because deep breathing can trigger the onset of an asthma attack, especially for those who suffer from the constricted airway type of the condition. So when I work with a student singer who has asthma, we refine our breath management work to include slow, steady movement of the air that some might misinterpret as shallow to avoid an acute bronchial constriction attack. As you may have already guessed, managing asthma when you sing can be a tricky balancing act. When accounting for the side effects of medication and the need to develop breath management strategies that facilitate healthy, sustainable singing that is also stylistically appropriate, the singer suffering from asthma will need to reconcile their need to sing alongside the arguably more important need to breathe. There is no getting away from the fact that asthma is a disease, and while it is generally well managed now in the 21st century, it can still limit life choices to varying degrees for some sufferers. Now, before I finish with 3 quick-fire, not-to-be-missed pieces of advice for those of you who live and sing with asthma, be sure to hit the thumbs up button if you're enjoying the video.
Sound check.
I mentioned earlier in the video that many of the medicines used to treat asthma can have some negative side effects on the voice. One sure way to help minimise the detrimental effects of the powdery drugs delivered by inhalers is to use a spacer. Spacers have been shown to deliver higher levels of the active ingredients deeper into the lungs than an inhaler alone. By reducing vocal tract lining deposits of the particles, side effects such as dryness and oral thrush are also reduced. But even when you do use a spacer, you should immediately rinse and gargle 3 times with room temperature water. Rinsing will help to wash away most of the residual powder, again promoting better vocal tract health. And one final piece of advice: I encourage all my students with asthma to inhale their medication, followed by a 5 to 10 second holding of the breath before exhaling. This will help to promote the better application of your medicine. And if you think your singing is suffering because of your asthma, then I highly recommend you work alongside an experienced singing teacher or a singing voice specialist to develop strategies for minimizing the impact of the disease on your singing. Be encouraged, you can learn to sing with asthma, but you will need to learn to manage your asthma accordingly. I hope today's video has been helpful. I know that there is a wealth of wisdom in the Voice Essentials community, so be sure to leave any comments below offering further helpful tips for managing asthma, as well as any questions you might still have about asthma and singing. And of course, if this is your first time you've ever watched one of my videos, then I eagerly invite you to visit my channel and subscribe for more videos about vocal health, learning to sing and vocal performance. I look forward to seeing you in the next Voice Essentials video. I'm Dr. Dan. Sing well.